Hello, everyone, and welcome to EngGlowUp, the channel where we turn everyday moments into English learning. I'm Flora.
And I'm Michael. Today, we're going somewhere that makes a lot of people nervous.
The doctor's office.
Yes, and visiting the doctor when English is not your first language, that is a very stressful experience.
Because it is not just about vocabulary, it's about describing how your body feels, clearly and accurately.
And most learners say the same things. I feel tired, I feel bad, I have pain.
Which are not wrong, but they aren't enough.
Not enough?
When you say, I feel tired, to a doctor, they can't do much with that. Tired is very general.
General, not specific. It could mean many different things.
But when you say, I have a sharp pain in my lower back that gets worse when I sit for more than 30 minutes, that's something the doctor can work with.
That tells them where, what kind of pain, and when it gets worse.
And that information helps them find the right answer much faster.
So today, we're going to show you exactly how to describe your symptoms in English.
We'll go through 4 real doctor visit scenarios.
Flora will visit the doctor for a headache problem. I will visit for back pain.
We'll show you how to describe pain, how to answer the doctor's questions, and how to ask for the next steps.
And along the way, you'll hear all the vocabulary and phrases you need.
One important note before we start.
This episode teaches you English for medical conversations. It is not medical advice.
Always see a real doctor for your health concerns. We're English teachers, not doctors.
Very much not doctors.
Before we start, please subscribe to EngGlowUp and give this episode a like. New episodes every Monday, Wednesday, and Friday.
Now, let's go to the doctor.
Before we go into the scenarios, let's understand why specific language matters so much.
Because when I first started visiting doctors in English, I always said the same things.
What did you say?
I don't feel well, I'm very tired, I have pain.
And what happened?
The doctor asked more questions, and I didn't know how to answer them.
Because the doctor needs specific information to help you.
Let's look at some weak descriptions and stronger versions.
Weak description, I have a headache. Weak, I have a headache. Strong, I have a throbbing pain on the right side of my head. It started 3 days ago, and it gets worse in bright light.
Throbbing, a beating pain, like a pulse. Bang, bang, bang. You can feel it beating.
And notice the strong version tells the doctor 3 things: where the pain is, when it started, and what makes it worse.
3 pieces of information, much more useful.
Another one, weak, I feel tired all the time. Weak, I feel tired all the time. Strong, I feel exhausted even after 8 hours of sleep. My legs feel heavy, and I have difficulty concentrating at work.
Exhausted, extremely tired, much more tired than just tired.
Difficulty concentrating, finding it hard to focus. Your mind can't stay on one thing.
And the legs feel heavy, that's a very specific physical sensation, not just a feeling.
A sensation, something your body physically feels, not an emotion, a physical experience.
One more. Weak, my back hurts.
Weak, my back hurts. Strong, I have a sharp, stabbing pain in my lower back, just above my left hip. It started after I lifted something heavy last week, and it hasn't gone away.
Sharp, like a knife, sudden and intense.
Stabbing, like something is being pushed into you, a deeper, more intense version of sharp.
Lower back, the bottom part of your back, above your hips.
And the cause, I lifted something heavy. This is very important information for the doctor.
Cause, the reason something happened, what started the problem.
When you tell the doctor what started the pain, they immediately have a much better picture.
A better picture, they understand the situation more clearly.
These 4 questions, where, what, when, and what makes it better or worse, are the foundation of every good medical description.
If you can answer all 4, you're giving your doctor exactly what they need.
And the conversation becomes much more productive.
Productive, useful, achieving something real.
Let us build your vocabulary for describing pain and physical sensations.
Sharp pain, a sudden, intense pain, like a knife cutting you. It comes quickly and it feels very strong.
Sharp pain often suggests something sudden, like a muscle pulling or a nerve being touched.
Dull pain, the opposite of sharp, a dull pain is less intense but constant. It stays there. It does not go away, like a low, steady ache.
Ache is a continuous, dull pain. Your head aches, your muscles ache after exercise.
Throbbing pain, a beating pain. It pulses. You can almost feel your heartbeat in it. Common with headaches and infections.
Burning pain, it feels like fire or heat on your skin or inside your body. Common with nerve problems or skin conditions.
Stabbing pain, like something sharp is being pushed into you suddenly. Very intense. Often comes and goes.
Shooting pain, the pain moves. It travels from one place to another, like electricity going down your leg.
Pressure, it feels like something heavy is sitting on top of you or squeezing you. Common with chest problems and headaches.
Tightness, like something is being squeezed or pulled tight. Common in the chest, throat, and muscles.
Cramping, a sudden tightening of a muscle, like the muscle is squeezing itself. Very common in the stomach and legs.
Numbness, you cannot feel anything. The area has no sensation, like when your foot goes to sleep.
Tingling, a pins and needles feeling. Small prickling sensations, like little sparks on your skin.
Pins and needles, yes, that familiar feeling when a part of your body has been in one position too long and the blood comes back. Now, location. How to describe exactly where the pain is.
On the right side, on the left side. Upper, lower, front, back.
Behind, in front of, around, inside.
For example, I have pain on the right side of my lower abdomen.
Abdomen, the stomach area, the front of your body between your chest and your hips.
I have tightness in my chest just behind my breastbone.
Breastbone, the flat bone in the center of your chest, also called the sternum.
I have pain behind my right eye.
I have tingling in my left hand, especially in my fingers.
I have a dull ache in my lower back just above my right hip.
Notice every one of those descriptions is precise. The doctor knows exactly where to look.
Precise, exact, no guessing required.
The pain does not always stay still. Sometimes it moves, sometimes it comes and goes.
It radiates. The pain spreads out from one place to other areas, like a headache that radiates into your neck.
Radiates, spreads from the center outwards, like light radiating from a lamp.
It comes and goes. The pain is not constant. It appears, disappears, appears again.
Constant, never stopping, always there.
It is worse in the morning. It is worse after eating. It is worse when I move.
It is better when I rest. It is better with heat. It is better when I lie down.
These trigger phrases, worse when, better when, are extremely useful.
Trigger, something that causes the pain to start or get worse.
Okay, scenario 1. Flora is at the doctor. She's been having headaches for 2 weeks.
And I want to show exactly how to describe them clearly. Watch how I answer each question.
Good morning, Flora. Come in and sit down. What brings you in today?
Good morning, doctor. I have been having very bad headaches for about 2 weeks now. They're getting worse and I'm worried.
I'm glad you came in. Can you describe the headaches for me? Where exactly do you feel the pain?
The pain is mostly on the right side of my head. It usually starts just above my right eye, and then it spreads to the right side of my forehead and my temple.
And what does the pain feel like? Can you describe the sensation?
It's throbbing, like a beating pulse. Sometimes it's also a very intense pressure, like something is pressing on the inside of my skull.
How long does each headache last?
Usually between 4 and 8 hours, sometimes longer. Twice last week, I woke up with one and it lasted almost all day.
Is there anything that makes the headaches worse?
Bright light definitely makes them worse, and loud noise. When I have a headache, I have to go into a dark, quiet room.
And anything that helps?
Lying down in a dark room helps a little. Cold water on my forehead sometimes helps. Painkillers help for a while, but the headache comes back.
Have you noticed any other symptoms alongside the headaches? Nausea, vision changes, dizziness?
Yes, nausea. I feel sick to my stomach during the worst headaches, and sometimes my vision goes a little blurry just before the headache starts.
That's very helpful, Flora. How is the pain affecting your daily life?
It's making it very hard to work. I can't concentrate when I have one, and I've been canceling plans with friends because I never know when one will start.
I understand. On a scale of 1 to 10, 10 being the worst pain you can imagine, how would you rate the headaches at their worst?
At their worst, about a 7 or 8, sometimes a 9.
Thank you for describing that so clearly, Flora. Based on what you've told me, the location, the throbbing quality, the sensitivity to light and sound, and the visual disturbance before they start, these sound like they could be migraines.
Migraines, I've heard of those. Are they serious?
They're very common, and there are good treatments available. I would like to refer you to a neurologist for a full assessment. In the meantime, I will prescribe something for the pain. I also want you to start keeping a headache diary.
A headache diary. What should I write in it?
Every time you get a headache, note the date, the time it started, how long it lasted, what you ate or drank before it, and how severe it was on that 1 to 10 scale. This will help us identify any patterns or triggers.
I can do that. Should I come back if they get worse before my neurology appointment?
Yes, if the pain becomes severe and sudden, what we call a thunderclap headache, or if you develop a fever, stiff neck, or confusion alongside the headache, please go to the emergency room immediately.
Understood. Thank you, doctor.
Take care, Flora. The receptionist will give you the referral details.
And notice, I answered every question with specific information. Where, what type, how long, what makes it worse, what makes it better, how it affects my life. Part 3, and this is something many patients forget to do.
They describe their symptoms, the doctor explains, and then the patient nods and leaves.
Without really understanding what comes next or what to watch for.
And asking questions is just as important as describing your symptoms.
Let us go through the most useful questions you can ask your doctor.
Question 1. What do you think is causing this?
Very simple, very direct. You want to understand what the doctor suspects.
Suspects. Thinks is likely. The doctor may not be certain yet, but they have an idea.
Question 2, what are my options for treatment?
Options, the different choices available. Medicine, physiotherapy, surgery, rest. What are the possibilities?
Question 3, how long will it take to get better?
This is about timeline. When can you expect to feel normal again?
Timeline, the expected schedule of events, how long things will take.
Question 4, what should I avoid doing while I have this problem?
Because sometimes continuing to do something makes the problem worse.
And your doctor can tell you what activities to stop or reduce.
Question 5, what should I do if it gets worse?
This is very important. The doctor already answered this in our scenarios, but you should always ask.
What are the warning signs? When should I come back? When should I go to the emergency room?
Warning signs, specific symptoms that mean the situation is becoming more serious.
Question 6, should I come back for a follow-up?
Follow-up, a second appointment to check how you were doing after the first visit.
And question 7, is there anything I can do at home to help?
Home remedies, things you can do yourself. Rest, heat, ice, gentle exercise, diet changes.
These 7 questions will make sure you believe the doctor's office with a complete plan, not just a prescription.
Prescription, a written instruction from the doctor for medicine you can collect at the pharmacy.
And here's one more very important phrase. If you do not understand what the doctor said,
You ask. Always ask.
could you explain that again, please? Or, I'm sorry, I didn't understand that word. What does it mean?
Doctors use medical words that are not common in everyday English.
And it's completely fine to say, I'm not familiar with that term. Could you explain it in simpler words?
Not familiar with, you haven't heard it before and don't know what it means.
A good doctor will always be happy to explain.
And if you feel your concern has not been heard, you can say, I want to make sure you understand how much this is affecting my daily life.
This is not rude. This is advocating for yourself.
Advocating, speaking up for your own needs, making sure your voice is heard.
In a medical setting, advocating for yourself can make a real difference to the care you receive.
Before we wrap up, extra phrases that will make your doctor visit smoother.
Number 1, I've had this before.
This tells the doctor the problem is not new. It has happened in the past.
I've had this before, about 2 years ago. It went away on its own.
Number 2, this is new for me. I have never felt this before.
This tells the doctor the symptom is unusual. It's different from your normal experience.
Number 3, the pain comes and goes.
Not constant. It appears and disappears, sometimes worse, sometimes better.
Number 4, the pain is constant. It never completely goes away.
Always there. Even when mild, it's always present.
Number 5, it started suddenly.
The pain or symptom appeared very quickly. One moment it wasn't there, the next it was.
Number 6, it's been getting gradually worse.
Gradually, slowly, over time, not suddenly. A little worse each day.
Number 7, I've been taking painkillers, but they're not helping much.
Painkillers, medicine that reduces pain, like paracetamol or ibuprofen.
Number 8, I also have a history of.
History of, you've had this condition or problem before, or someone in your family has.
I also have a history of high blood pressure. My mother had diabetes.
Number 9, I'm currently taking.
The medicine you take regularly. Always tell the doctor about all your medicines, including vitamins and supplements.
Supplements, additional vitamins or nutrients you take in addition to food.
Number 10, is this something I should be worried about?
A simple, direct question. You want to know if this is serious.
And the doctor will tell you honestly.
Or they'll say, I'm not sure yet and I want to investigate further.
Investigate to look into something carefully to find out more.
And that's how you describe your symptoms clearly to your doctor in English.
Let's do a final recap.
Instead of just tired or I feel bad, give the doctor 4 things.
Where the pain is, what it feels like, when it started and how often, and what makes it better or worse.
Use the pain vocabulary: sharp, dull, throbbing, burning, stabbing, shooting, pressure, tightness, numbness, and tingling.
Use the comparison phrase, it feels like. It feels like an electric shock. It feels like something is pressing on me.
Describe the functional impact, how the pain is changing what you can do in your daily life.
Use the pain scale 1 to 10. It's a simple tool that gives the doctor very useful information.
And always ask questions. What is causing this? What are my options? What should I watch for?
Your health is important, and your voice in the doctor's office is important.
Speaking clearly helps you get the help you need. Pause 1 second. One important reminder before we go.
This episode teaches English language skills. It is not medical advice.
Please always see a qualified doctor for any health concerns. We are here to help you communicate, not to diagnose.
But we do hope this helps you feel more confident in that consultation room.
Your homework. Think about a health issue you've had recently, even a simple one, a cold, a headache, a sore muscle.
And try to describe it using today's vocabulary. Where was it? What did it feel like? What made it better or worse?
Write your description in the comments. Flora and Michael read every single one.
If this episode helped you, please give it a like and share it with someone who needs it.
Subscribe to EngGlowUp for new episodes every Monday, Wednesday, and Friday.
We're Flora.
And Michael.
And this is EngGlowUp, the channel where we turn everyday moments into English learning.
Take care of yourselves and speak up for your health.
Bye, everyone.
Bye.